Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Lachman Test for an ACL Tear. The Lachman test is used to diagnose an anterior cruciate ligament, ACL, tear. The ACL is one of four major knee ligaments that contribute to the stability of the knee joint. An ACL tear often occurs as a sport-related injury and may require surgical reconstruction for treatment. /r/n/r/n This article will discuss what the Lachman test is and how it's performed. It also covers the results of the Lachman test, how they're graded, and what they mean. /r/n/r/n The Lachman test uses two criteria to evaluate the condition of the ACL. The first shows whether the ACL is appropriately limiting the amount of movement in the knee joint. The second measures the amount of movement in the joint, comparing the injured leg to the non-injured side. /r/n/r/n The Lachman test is the gold standard for diagnosing ACL injuries and can help healthcare providers determine the best treatment course. For best results, the Lachman test is performed before the person injured experiences swelling and pain. /r/n/r/n The test can be performed manually or with the help of a tool called KT1000. Specialists who typically perform the Lachman test include athletic trainers, physical therapists, orthopedic surgeons, and primary care physicians. /r/n/r/n With the patient lying flat and relaxed, the examiner will do the following. /r/n/r/n The test places stress on the ACL. Some healthcare providers use a tool called a KT1000 to perform this test. The KT1000 has been shown to be a reliable measure that can more precisely measure the grade of the Lachman test. /r/n/r/n The following criterion offer information about the ACL. /r/n/r/n Knees with a damaged ACL may demonstrate more movement and a less firm endpoint during a Lachman test. /r/n/r/n Most examiners grade the results of the Lachman test on two criteria. First, the endpoint, and second, the amount of laxity. When assessing the endpoint, the examiner is feeling for the ACL limiting the amount of shifting of the shin bone. /r/n/r/n Typically an examiner will describe the endpoint as either firm or soft. A firm endpoint implies the ACL is doing its job to limit the amount of movement in the knee joint. /r/n/r/n A soft endpoint is indicative of the ACL not functioning well and other structures limiting the amount of movement in the joint. These other structures are known as the secondary stabilizers. /r/n/r/n The second criterion to assess the Lachman test is the amount of laxity, movement, of the joint. The grading is based on a comparison to the non-injured extremity. Therefore, it is common for your healthcare provider to examine both knees to determine the grade of the Lachman test. /r/n/r/n The amount of movement is compared between the two sides of the body. The following grades can be assigned based on side-to-side differences: /r/n/r/n. These measurements can be difficult to quantify, and often different examiners may come up with different results. /r/n/r/n The Lachman test allows for a quick and accurate diagnosis of an ACL injury. Prompt diagnosis and treatment can lead to better treatment and rehabilitation outcomes. /r/n/r/n The Lachman test has been considered the gold standard for diagnosing ACL injury. In a 2022 review of studies, the test was shown to have a sensitivity of 81% and a specificity of 85%. Together, these values make up the diagnostic accuracy value of the test. These estimates were lower than previously considered for the test, so more research is needed. /r/n/r/n Another 2022 review found the sensitivity of the Lachman test to be 79%. The Lachman test was still considered to have high accuracy for ACL injury diagnosis, but other tests were recommended over it. /r/n/r/n The Lachman test is a variant of the anterior draw test. The two tests can both be used to diagnose ACL tears, but the Lachman test is generally considered more accurate for this purpose. /r/n/r/n The Lachman test is typically used by healthcare providers to diagnose acute ACL injuries. Specialists such as physical therapists, athletic trainers, or orthopedic surgeons can perform the test manually or with the help of a tool called KT1000. /r/n/r/n The test helps provide a quick and accurate diagnosis for people who've experienced a leg injury. This can improve treatment outcomes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.